Hi, this is Woody.
And this is Dale, and we're here to give you some guidance as to how to conduct the chart audit of advanced care planning in this baseline period.
And the chart audit of advanced care planning is one of those things that we are hoping will really change, really improve over the next 18 months at your dialysis center or CKD clinic. These are the parameters of the chart audit, and you'll see this again, but just to remind you. Next slide. And so if you're wanting to assess a delivery system innovation, and certainly the Pathways Project is a delivery systems innovation, one of the things that you need to do is describe the baseline performance. And so that's why we're doing this initial advanced care planning chart audit. Next slide. So there is this definition that we introduced you to at Learning Session 1. It has two components to it. Advanced care planning is a process that identifies patients' values, life goals, and preferences. And then it's also a system that helps ensure that people receive the medical care that they want. And the chart audit is going to help us. These 8 parameters are going to help us see how well we're doing advanced care planning in dialysis centers and CKD clinics in the Pathways Project. Next slide. So just to remind you that one of the components and one of the best practice recommendations that we are examining during the Pathways Project is how well we're implementing shared decision making for current and advanced care planning for future care options. Next slide. And recall that shared decision making is poorly integrated into the care of our patients with kidney disease, and that advanced care planning is not systematically done. And again, this audit should show, and this is the reason why we're doing the Pathways Project, that you have not been doing the advanced care planning as well as you might be doing it during this baseline period or during the year and a half prior to this baseline period. But then again, by the end of the Pathways Project, hopefully the audit will show that you have been systematically doing advanced care planning. Next slide. And what's new and different about the Pathways Project, that we are intentionally engaging patients in conversation with regard to their values and wishes, and we're identifying those patients who are most ill to engage them in these conversations, and we're collecting data to document how well our innovation worked. Next slide. And this is to remind you the POST form, and it's called Different Things in Different States. This is one of the things that we're going to be documenting in the audit, whether or not a patient has one. And hopefully as a result of the Pathways Project, you will be completing more of these forms for your seriously ill patients, for those of you in states where this type of form is available. Next slide. And again, just to remind you, so decision-making capacity assessed, surrogate name, goals of care discussed within 30 days of hospital discharge, whether or not there are completed advanced directives that are documented in your electronic health record, whether or not there are PULSE forms that are completed, whether or not you have forms in your electronic health record, or if you have a registry and those forms are available to you in a registry. Over to you, Dale.
Great. So we're now going to move through how do you actually find and record this data for the baseline chart audit. And the first thing to know is that there is a new operating manual. We call it the Protocol and Operating Manual, and you can find it and download it from the intranet box. And in the Appendix B, it's got instructions for you around how, sort of step-by-step, how to conduct this audit. But this is what we're going to go through now. So first is you go to the box, and I'm going to show you that in a minute. I'm going to actually do it, and you can watch me do it on the screen. But just to remind you, you're going to go to the box. You're going to download from the box, and this is what the box looks like when you get there if you haven't been there yet. And then you're going to download in this section called Pathways Intranet Site. You're going to go to Action Period 1 and Data Collection Instruments and Instructions, and now you'll find an Excel spreadsheet called the Baseline Chart Audit Template. So you want to download the template, and you want to download a Word document that says Audit Instructions. You want to make sure that you download to your desktop. In other words, Box does let you work in something in Box, but then you'll be putting your data in for everyone else. So make sure that you download especially the Excel template to your desktop, to a file on your desktop, and that you then open it from your desktop to enter the data. And then another important reminder at the end, but I'll say this several times, before you email it to us, be sure that you delete the column that is where you were keeping your patient identifier. So if Mary Smith in your record is number 1, and that's how you were keeping track, make sure you delete that column before you email it to us. So when you go into the Excel spreadsheet, it'll open to a tab that has some instructions, and then there'll be a place where you can actually enter the data cell by cell in Excel. And that has both instructions, little definitions of what we're looking for, and then little drop-down menus where you can just click, and almost all of them are clickable, so you just click the right choice. And then the instruction sheet and the Excel spreadsheet have definitions of what we're looking for each of the data elements. All right, so now let's actually do this. When you click on the link that is in the slides, you'll come to the Pathways intranet site. You want to click on Action Period 1. And you want to click on Data Collection Instruments and Instructions. And here's where we want both the baseline chart audit template. So you're going to click on that. And it brings you here, to this template, which will open to an initial summary page, and then there's a data tab down below, so you can click on the data tab. But the first thing that you need to do to download the chart audit template, there is a button that says download. So you click the download button and it'll ask you where you want to put it. And I'm going to put it just on my desktop. You may have a folder where you're keeping your data collection. I'm now going to open this chart audit template from my desktop. So important, you are going to download it to your desktop and open it from your desktop, and you're going to want to save it eventually with your own name and with your dialysis center, your site's name. So here you are at the summary page, and we'll ask you to put here what your site is. You see this menu, a little arrow to the right. When you click in the cell, there's a little arrow, that gray arrow to the right, and if you click that, it gives you a choice, a menu choice. So let's say you're from Newtown, and then you're going to type in here the dates that the review was conducted. So this is June 2019, and it ended June 13th, 2019. And this is the period you covered, and later on you'll see that there are dates, and so you will have covered January 1, 2018 to April 10th, thank you, 2019. And here it is, I'm Dale Lupu conducting the review. So you put all of that in. Then the data sheet, you clicked down below, there are tabs at the bottom left of the Excel spreadsheet. You will then click on the data tab, and this brings you to where you enter the data. So let's look first at these instructions. We talked about this a little. Let's look at it again in the top left, in the yellow box. It says instructions. So first, this is the way we'd like you to do the chart audit. Go to whatever area advanced care planning is supposed to be in for your center, assuming you have a place where it's most likely or supposed to be. Some places do have an actual advanced care planning area of their EMR or their chart. That's where you go first. And in that section, feel free to take anything that's there with no time limits. Then as you search other parts of the chart, we want to make this easy for you. So we only want you to search a single chart for no more than 10 minutes or no farther back than January 1st, 2018. So in other words, only look in the chart for about 10 minutes, only go back about a year and a quarter at this point. You can record, if you find forms, if somebody has their advanced directive form or their POLST or their MOLST, you can record the most recent one that you find of any date. So let's say there's one that's from 4 years ago. Somebody was at a fair, advanced care planning fair, health fair, they bring it in, it's 4 years old, but it's an actual form and you find it in the chart, go ahead and record that, that's fine. But when you're looking for discussions, so did the nephrologist and the patient have a discussion about their goals of care, and you're recording the discussion, we only want recent discussions since January 1st, 2018. If you don't know the date, it's fine to just record it and give us a note. That there's a note section here, and you can give us a note. You recorded something where you weren't sure of the date. So you're gonna, here, now let's look cell by cell how you enter the data. So the rows, each row is for one patient. And here you're gonna, in the yellow, where there's the yellow heading, column C, this is for your use. This is where I keep saying you're gonna delete this column before you upload it, but this is just so you can keep track of what you're doing. So this is serious ill patient number 1, Mary Smith. You're gonna put in either the ID that you know her by or the medical record number, just so you can keep track of what you've done. And then this is the patient identifier. Either you can just make this up current, with Newtown 1, or if you already know these from having submitted them for the interviews, you can use that list. But it's fine if you just enter just your own number here, and then you'll be giving us that link code later. Age group, this one is relatively easy. You just pick where they fall and you pick a group. Gender, this is got several choices. Race has several choices. Ethnicity, so if you can see what I'm doing as I click in the cell, a little arrow appears to the right and I choose a option. Diagnosis code, you'll only choose one of these, but we've given you, there are several ways that clinics tend to do this. One is with these stages, or alternatively, if you do it with diagnosis codes. So whatever way works for your center, that's fine. Now we're moving into the more content area. So was their mental capacity assessed? Woody, do you want to talk a little bit about these choices?
Sure. So, and this is again January 1st, 2018 to the present. The documentation, the most recent documentation, is what you would want to use. And there may be no documentation, which case you would hit 0 for no information. There may be a statement that the patient lacks capacity, but there may be no reason for that. So then you would mark that 1. Or if there's a statement the patient lacks capacity because the patient doesn't understand what's wrong with her, then that would be a 2.
Okay. And there, again, in the definition section of the instruction sheet, there's a little bit more discussion of what we mean by those. So if it's not clear, check that instruction sheet. So now, is there a healthcare agent, sometimes called a proxy, sometimes called a surrogate? This is the person that the patient has named to make decisions for them if they can't make decisions for themselves.
And Dale, can I add, it might be, well, it can be called a healthcare proxy in New York and Massachusetts, could be called a durable power of attorney for healthcare, could be called a healthcare agent, could be called a medical power of attorney. So whatever your state calls that designation in an advance directive for the decision maker for the patient.
Right. And so here's what we'd like. We'd like this level of information. So you don't find anything, or there's a statement that the patient has said, no, I don't want to name someone, or sometimes there's a statement that's their sister, no, let's say sister is their surrogate, but there's no name, there's no contact information, and what happens is there may actually be 3 sisters, and so the chart doesn't help you know which sister. So then even better recording is that the name is actually there, but there's no contact information. And finally, what we're hoping will happen is that the name and some contact information is clearly accessible in the chart. This is the most useful thing if the surrogate should be needed. Moving on to goals of care discussions. So this is the one that may be, take your judgment call to decide whether this is a goals of care conversation or not, because they won't always be labeled goals of care. Woody, could you talk a little bit about what we are looking for here?
Sure. In this section, we want to know, was there a discussion with the patient of their values, preferences, and goals? For example, they might have said, I want to die at home, or I wouldn't want to die in a nursing home, or I wouldn't want to be kept alive if the only way to do it was to surgically implant a feeding tube. So no information would be, there's no documentation that there was a goals of care discussion held. One would be if there was a date and a statement that a goals of care conversation was conducted, but there was no content. And number 2 would be there was actually some content. So a goals of care discussion was held on such and such date, and the patient determined that the patient would not want CPR and would not want to be on a breathing machine at the end of life. That would be an example of the type of conversation that you would want to document.
Right. And some of you may have templates or checklists, and we would, if it's only a template, it's sort of only like DNR, yes, no, that would be a choice number 1. But if it's recording some more substance, so often good practice is for an actual quote from the patient to be recorded, something that really lets us know this was a discussion, then that would rise to a number 2. And of course, these conversations may be happening, but not recorded. And so what you're looking for here is evidence that it was recorded in the chart. And then we would like the date of whatever the most recent conversation that you found. And then we would like, if you can see it clearly, who conducted it. Sometimes it might not be known, but generally you'll be able to tell who, I would hope you'll be able to tell who conducted it. And it could be from a team meeting. So there could be a whole team. That's an option for you. Okay, now we move to, are there POLST, MOLST, or DNR orders actually in the chart? And this is any one of these orders. And Woody, could you talk again about the distinction between an order versus, we're going to move on to an advanced directive in the next cell?
So an order is something that's issued by a physician or a nurse practitioner or a physician assistant, depending upon the state and what the state allows, various healthcare professionals to do. But this is a medical order that's generated as a discussion with a healthcare professional. And I'll say, as opposed to an advanced directive where there does not need to be a discussion with a healthcare professional, and it does not need to be signed by a healthcare professional. An advanced directive is entirely generated by the patient, typically with witnesses.
So in this cell, in this column, you're going to record whether there was an order or a MOLST or a POLST, and in this cell, you're going to record whether you found a form, an advanced directive that's completed by the patient. And an option here is you may see a statement that patient has the advanced directive, but it might not be in the chart, so that would be a 1. And if you can actually retrieve the advanced directive itself from the chart, that gets a 2. And then we have, has the form been entered in a registry? My understanding of practice for most of you is that this will be unlikely. You won't be finding it very often. For the VA sites, this may be more often because the VA does have a registry. In New York State and some other states, there are registries. So this is a database in which forms are actually uploaded, and they are accessible to multiple providers. And there are some private registries. So there's a range of registries, but somewhere you would want to be seeing evidence that that this person entered it, let's say in the state, in the state's post registry, for instance, like in West Virginia, the post registry that Woody helps to run. Anything else there, Woody?
No,
Okay.
Yeah, that's good.
And then we've got 3 just free text. If there's anything else that you found that was interesting and you want to tell us, either yes or no. So if yes, then just type in here. I found a discussion about patient wants to live to see grandchild graduate, talked with NP, not sure, date, not sure if it was really goals of care discussion, and anything else you want to tell us. I couldn't find the dates, but I recorded things. Anything else that you think will be helpful for us to understand what happened here.
Right. And Dale, if I could add, it's not uncommon that patients might say, I want my brother to make decisions for me if I become too sick to make them for myself, but I don't want to fill out any forms. So that's basically a verbal expression or a verbal advance directive, and that could be documented too.
Yeah. So that's how you fill this out. And then the important step, you click on, so you will have given a code number here. You will save this. So you're going to save a copy so that you've got a copy that is what we call a code link. You know the identifier for you and for this and that who is N1. You save that. But to send it to us, you click on column C, go up to column Edit at the top, the menu choice Edit, and delete the column, and that it disappears. And now you're going to save this file, save as, wherever you're going to save it. I'm saving it to my desktop, and I'm going to give it a name. I think this is Newtown Baseline and no ID, and then I save it. Doesn't really matter what you call it. Just what's really important is that before you send it to us, you've stripped out that identifier column. And then you're going to email it. And again, this is a secure email, pathways_data@gwu.edu. So let me go back to the last couple things on our slides. So just remembering these are the things we're looking for. And as Woody said, this is baseline. We expect you're not actually going to find a lot. That's our expectation. But when you do this again, about a year and a half from now, we expect you'll be so busy writing it all down, you won't know, it'll be great. And when you finish, you email it to us at the secure data, pathways_data@gwu.edu. You've deleted the column before you email it. And if you have questions, Kim can answer kind of the data collection. How does the spreadsheet work? I'm having trouble downloading or uploading. And I'm happy to answer anything about content, definitions, Woody as well, but why don't you send them to me and I'll consult with Woody. And going back to the box again, so just a reminder that you can get these instructions. Here's where the audit template is, which is an Excel spreadsheet, and here's where the instructions are. The instructions are a Word document, and they have in written form everything we've been telling you now, and then they also have the definitions. And as I said earlier, some of these definitions have a little bit more explanation, kind of what Woody and I have been talking you through on this recording. So we hope this was helpful, and if you have questions, please reach out to us. Thank you for working on Pathways, and thank you so much for engaging in this project so that we can improve care.
Yes, thank you very much. This is a very important part of the Pathways project.
Thank you.
Bye.